Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with Dr. Millicent Rovelo, who is definitely on the point of our topics for the day because she came up with all three.
I did, yes, except for this one that we're doing right now.
Because we got an actual call-in question from the audience while we were sitting here.
While we're sitting here, we got a call-in from a listener from the audience asking a very pointed question, and we said, you know what? Let's make that our next podcast.
So my daughter, who's in college, called in and said, is it possible to get rid of tech neck?
Tech neck.
Tech neck, which is from technology, hanging down and looking at your phone that you get
all day, all the time.
Get wrinkly and
crepey
redundant and crepey skin. And
yes.
So
it's a thing.
It is a thing, and evidently it's a thing in the 18 to 22-year-olds because she was asking about for a friend, quote unquote.
Asking for a friend.
Asking for a friend. Can we get rid of tech neck?
Yes. And so tech neck, what happens here is, as you just referenced, you have your phones. We are all constantly looking down at your phones. And I try to make an effort, because I'm always aware of this, of like bringing the phone up so that I'm not cranking my neck down. But obviously I forget all the time. So you are constantly, putting your head down. And what ends up happening is you start to get these lines, the horizontal lines that go across the neck. The skin gets a little crinkled, a little bit wrinkly. And so it's not so much that you're making the skin looser so much as you are sort of changing the texture of the skin itself and the lines.
Well, there's also I wonder, do you actually, from doing this over and over again, do you actually create like a stretched out skin, like a excess skin situation?
I don't think so, because how are you stretching it?
Well, just the motion back and forth where it's in this situation, and then you're kind of like, do you cause it to respond to the positioning? I don't know. I mean, I'm asking it. I'm just, I'm sitting here thinking through it, like, why is tech neck really, because that's a new phenomenon. That's since the cell phones have gone bananas since 2006, 7, 8, when they've become like these smartphones that you do everything, basically handheld computers that you walk around with.
Right.
That's what's caused this phenomenon of tech neck, and I understand, what my daughter's asking about. So yeah, the ways to treat it, there's all sorts of things. Depends how severe it is.
I mean, maybe if you're constantly looking down, you're sort of weakening the ligamentous structures that attach the skin to the underlying deep structures, so it makes it a little bit looser. Maybe. But whatever's causing it, you have to treat it based on the degree.
Well, what's causing it are the smartphones. So we should just get rid of those. That's the first move.
Wouldn't that be great?
but that's not going to happen, is it?
And it's not going to happen. So depends on how severe it is. So say you are in college asking for a friend. What you probably have at this stage is more of a texture fine line problem. And so this is going to be best treated usually by some kind of energy device or laser that's treating the superficial surfaces of the skin.
Yeah, I mean, I think I think for this age group, like I like, liposculpture. I remember I remember when I was a resident, Mark Liang, who I think is one of my favorite plastic surgeons from Pittsburgh, and just a real thoughtful aesthetic surgeon. He brought a patient who was 20 years old to the OR and said, well, we're doing neck liposuction. I was like, well, I don't see anything to suction here, Dr. Liang. What's the deal? And he said, well, I just need to run the cannula through here. I might get out 3, 4, 5, 7 cc's of fat. That's not the point. I'm trying to get the skin to scar down to the underlying tissue and create a tighter look for the neck. And so I think that's a real nice way to treat that without having to go, into, I mean, I don't know, maybe the face tight's sort of the same thing.
Yeah,
I think maybe that's what he was doing even without the energy. He was just pushing the cannula through the soft tissue to get scarring, which I typically take out some fat, but you can definitely count on some retraction in young people.
Yes, that's going to say it has to be a person that really doesn't have any loose skin. Because if you solely do liposuction, you could also make the problem worse if you already have some loose skin. So this is for the really young patients. Maybe that could work.
Yeah.
This is also where things like the FaceTite or Renuvion, energy devices that are applied to the undersurface of the skin at the time of the liposuction, with or without removal of fat, can be really helpful because they will help to tighten the skin. So it really just depends on how much loose skin you have, whether or not you have extra fat as well. If you have extra fat under the neck or under the chin, it's a no-brainer. You take some of the fat plus minus in an energy device. That's a beautiful operation. That works really well. Or you just do the energy device if what you have is a little bit of loose skin. But none of these operations are going to necessarily address the superficial texture of the skin. So fine lines, coarse texture. Those are best addressed with, I think, things like an ablative laser. So CO2 erbium. Or I also really like microneedling in this area. I don't think you need to do aggressive microneedling like Morpheus. Morpheus is microneedling with radiofrequency energy. You can, but I also think just regular generic run-of-the-mill microneedling on the neck works really well at improving the surface texture, especially in these younger patients.
Yeah, and I like Potenza, for the Potenza's the Cynosure product, for which I'm also a luminary for them, just for disclosure. But I like Potenza for the superficial, especially for neck skin, because I think Morpheus on the neck is pretty painful, number one, but it works.
It's not that painful, actually, but it is very aggressive, and it will definitely...
That's coming from you, who does Morpheus to yourself. So
yeah, but the neck skin is so thin, it numbs up really easily, right. And so I find it to be less painful on the neck. I can go on the neck a lot easier than I can on the face.
How was that?
Yeah,
that's good.
It's kind of what it sounds like. But so I don't think that it's so much painful. That being said, as an avid self-user of Morpheus, the neck, especially me, I find just takes a lot longer to recover. I have little red stamp marks on my neck for like months. As opposed to microneedling, you don't really have that as much.
Yeah, because the Potenza and the Morpheus put radio frequency energy through the microneedling, and I think those are all on the spectrum of what to do for tech neck.
For tech neck. So
when do you do a neck lift?
Yeah, that would be the next thing. So now you're coming out of the college age, you're getting into the 30s, 40s. These are the people who may or may not benefit from the skin tightening devices, really, the FaceTite and Renuvion, if they're not quite in a facelift, neck lift category. But once you start getting some loose skin that can be played with, that's when you're really more in neck lift category. And I don't even know if that's really going to be considered tech neck at that point. It's just a facelift.
Well, men don't have facelifts. Remember, they have neck lifts with upper facial extension.
Yes.
I had a patient this week who came in for a neck lift with an upper facial extension because he goes, what can you do about this neck? And this is exactly what he does. He's kind of pulling on his platysma muscles. He goes, and that'll get rid of all this too, right? That'll get rid of here. I was like, it absolutely will. So what I'll do is I'll do a little upper facial extension on your neck lift. He's like, that's what I want.
Yeah, that sounds good, yeah.
He's like, I'm not ready for a facelift, but if you could just come up here onto the face and get rid of this, that would be perfect. I was like, yeah, we'll do a neck lift with an upper facial extension.
Yeah, I got you.
Just don't worry about it. It's not a facelift. He's like, yeah, I'm not ready for that. I was like... But the neck lift is totally fine. It's a mental block.
You gotta
I
wrap
understand.
your mind around. It's fine.
I got it, guys. I got you. Don't worry. We know what to.
We will not do a facelift.
There's no facelifts here.
Facelifts.
We don't do that for men. We don't. I'm not going to have that. No, that's what you're going to do for me. You're going to do a neck lift
with an upper
facial extension, so that you can take care of this thing right here. That'd be great.
Yeah. Okay.
Can you do that?
I got that.
But I don't want a facelift.
No problem.
I'm not ready for that. I don't even need that.
You don't need that.
Right here. That's good. That's it. That's totally it right there. I don't need that. I'm not ready. I know. It's funny. But I mean, the best is, for a neck lift, though, where you can do an isolated neck lift. And I have done it on young people because they had redundant skin. It wasn't from tech neck, because I think the last time I did that was probably around 2012. And I think it was just somebody who was in their 20s and had excess skin, because there's a lot of genetic predisposition to having loose neck skin, and people can look at their mom and dad and be like, that's where I'm going, and if you're going there, then you're gonna go there. So if you want to head it off at the pass and get a neck lift, then you can do that. You can do incisions behind the ear. You don't need the upper facial extension if it's really just about the neck. You don't have jowls and a tight jawline, but in general, we wind up doing an upper facial extension because it just looks so good.
It just looks better.
And you're blending the deep plane facelift with the platysma work that you need to do in the neck. So that's it. I mean, I think those are sort of the approaches to tech neck, but I think for my daughter's cohort, they don't need neck lifts. They need some sort of energy device or a liposuction or something like that.
But I would say that in the older patients that need the neck lift or whatever, facelift, whatever we're calling it, I would argue that is not really going to treat the tech neck problems if they still have skin that is flawed. So
this is why it has to be, there's a comprehensive approach.
Yeah, which, this almost ties into the topic we were going to do, but that we're going to save for later, which is how to maintain your facelift.
Right.
So, and we'll give you a little teaser on that one. So you can do the facelift, but if you really want to address the texture of the skin, the fine lines that may have accumulated over time from looking down at your phone all day, you will still likely need one of these alternate energy devices as well.
It's an aesthetic attitude.
Can-do attitude.
It is an aesthetic attitude of, I'm going to look at, and it just, people get so they get a freaking, bee in their bonnet over, us talking about this like it's important, but people really care how they look.
Yeah.
There's nobody listening to this podcast right now that's just like, whatever, I don't care how I look.
If you're listening,
people care how they look.
Yeah,
they do. They care how they look. They brush their hair. They put on makeup. They make sure their teeth don't rot out of their head.
They try and lose weight.
They take care of their skin.
Yeah.
They wear aesthetics.
Yeah.
Aesthetics is important to human beings. They like to look good. So if you're really going to get into it, then having the just throw money at some aesthetic procedures approach doesn't work. You really need a comprehensive approach, and it makes a difference to get a can-do aesthetic attitude, which is important.
It's important.
It will make a big difference for you over time, and you won't blow all your money, and you'll get the synergy of doing things together. And that's why I hearken back to that quote I read when I was in college from Sophia Loren, where she said, get a good plastic surgeon and stay with them, get old with them, and they will keep you looking great because they'll know you and do the best for you. And that's really important. You want to have your plastic surgeon. And, jumping around and, trying to get I heard you go to this guy for that. And, no, you get somebody who's really good at this and you stay with them. And they'll tell you if they're not good. If they're really that good, they'll say, this isn't what I do.
Yeah, absolutely.
Just like I'm doing a total nose reconstruction with a radial forearm free flap, which is not really aesthetic surgery because everybody knows I reconstruct noses for all sorts of reasons. But I brought in an expert who can do the micro because I don't do that. Did I do that in my training and through my career and up to probably, 12 years ago? Absolutely. I think the last time I did microsurgery was 2012. I'm not going to do it today. I just don't do that. I'm not an expert in microsurgery. So I have a microsurgeon and I'll make the nose amazing. But if your plastic surgeon's that good, they're going to say that's not what I do. I don't do ptosis repair of upper eyelids. I get an expert to do that. Those are things that you want to make sure that your patient who's going to stay with you is going to get the best results possible.
Absolutely. It's all about having a plan and making sure that it works for your patient.
So for my daughter and her tech neck question, get the can-do aesthetic attitude.
Yes.
And that will make a big difference over time.
Yeah, I 100% agree.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.